A urinary tract infection, or UTI, is an unwelcome visitor that affects millions of people each year. It's an infection that can occur anywhere along the urinary tract, the system responsible for creating, storing, and eliminating urine from your body. UTIs are typically caused by bacteria, with E. coli, a common resident of the gut, being the primary culprit. These microscopic invaders can enter the urinary tract, leading to inflammation and a range of uncomfortable symptoms. While UTIs can affect anyone, women are more susceptible due to their shorter urethras, making it easier for bacteria to travel to the bladder. To understand UTIs better, let's take a quick tour of the urinary system. This vital system is made up of 4 main components. First, the kidneys. These bean-shaped powerhouses filter waste products from the blood and produce urine. Next, the ureters. These thin tubes act as the transport system, carrying urine from the kidneys down to the bladder. Then there's the bladder. This expandable sac acts as a reservoir, storing urine until it's time to be eliminated. Finally, the urethra. This tube provides the exit route for urine to leave the body. UTIs can be classified based on their location within the urinary tract. First, we have cystitis. This is the most common type of UTI, affecting the bladder. Cystitis often causes frequent and urgent urination, along with a burning sensation while urinating. Next, pyelonephritis. This is a more serious type of UTI that affects the kidneys. Pyelonephritis can cause fever, chills, back pain, and nausea, and requires prompt medical attention. Lastly, urethritis. This type of UTI affects the urethra, the tube that carries urine out of the body. Urethritis can cause pain or burning during urination and discharge from the urethra. UTIs often announce themselves with a range of uncomfortable symptoms, serving as your body's way of signaling that something is amiss. Common symptoms include pain or burning during urination, known as dysuria. This is often one of the first and most noticeable signs of a UTI. Frequent urination or frequency. Feeling the urge to urinate more often than usual, even if you're not producing much urine. Urgent urination or urgency. A sudden and intense urge to urinate, often accompanied by a fear of leakage. Cloudy or bloody urine. A change in urine appearance, such as cloudiness or the presence of blood, can indicate infection. Pelvic pain in women? Discomfort or pressure in the lower abdomen can be a symptom of a UTI. Rectal pain in men. Men with UTIs may experience discomfort in the rectal area. UTIs develop when bacteria, primarily E. coli, make their way into the urinary tract and multiply, leading to infection and inflammation. Several factors can increase your risk of developing a UTI, including female anatomy. Women are more susceptible due to their shorter urethras, which provide a shorter pathway for bacteria to travel to the bladder. Sexual activity. Intercourse can introduce bacteria into the urethra, increasing the risk of infection. Catheter use. Urinary catheters, while sometimes medically necessary, can provide a direct route for bacteria to enter the bladder. Diabetes. High blood sugar can impair the immune system, making it harder for the body to fight off infections, including UTIs. Pregnancy. Hormonal changes and pressure on the bladder during pregnancy can increase the risk of UTIs. Menopause. Hormonal changes associated with menopause can thin the vaginal tissues and urethra, making women more vulnerable to UTIs. Diagnosing a UTI typically involves a combination of medical history, physical examination, and laboratory tests. Your healthcare provider may recommend the following: urine dipstick test. This quick and easy test can detect the presence of white blood cells, blood, and nitrites in urine, all of which can indicate infection. Urinalysis. A microscopic examination of a urine sample can identify the presence of bacteria, white blood cells, and red blood cells. Urine culture. This test involves growing bacteria from a urine sample in a laboratory setting to identify the specific type of bacteria causing the infection. Imaging tests. In cases of recurrent UTIs or suspected kidney involvement, imaging tests such as ultrasound, CT scan, or MRI may be recommended to visualize the urinary tract and identify any abnormalities. Antibiotics are the cornerstone of UTI treatment, targeting and eliminating bacteria. Complete the full course as prescribed. In severe cases, hospitalization may be necessary for intravenous antibiotics. Stay hydrated to flush bacteria out of the urinary tract. Practice good hygiene and urinate after intercourse to prevent infections. Cranberry products may help prevent bacteria from adhering to the urinary tract. Consult a healthcare professional for prompt diagnosis and treatment. If you found this video helpful, please give it a thumbs up and subscribe to our channel.